Alzheimer's disease. It's one of the most devastating diseases on the planet. But there is hope on the horizon, so stick around, and I'm going to tell you why. Every 5 seconds, someone on Earth is diagnosed with Alzheimer's. It's the most common cause of dementia, and the associated healthcare costs, well, they're brutal. Just here in the US alone, we're talking hundreds of billions of dollars a year. But just forget about the financial cost for a minute. Think about the human cost. Someone diagnosed every 5 seconds. Maybe it's a parent, or a spouse, or a work colleague, having to face up to the reality that they're slowly losing their precious independence and their precious memories. It's kind of like vital information slowly being deleted from your brain's hard drive. And it's truly heartbreaking. Today, around 35 million people, mostly women, have Alzheimer's disease, and it's particularly prevalent in countries with aging populations, like Japan. That's where Keiko lives. She lives with her daughter, May. Just like May, if you've ever cared for someone with the disease, you know how much of a toll it takes on friends, on family members. It's a huge financial, but an also hugely emotional burden on society. And it's one that's increasing at a shocking rate as our global populations grow and age. In fact, by 2050, more than 150 million people are likely to be living with dementia, mostly Alzheimer's disease. But there is hope. Recently, treatment for the disease took a huge leap forward. Drugs that finally target the cause of Alzheimer's, not just the symptoms. And these drugs, they're being approved all across the world. They're called monoclonal antibodies, and they break down the amyloid protein deposits in the brain. It's what's thought to cause Alzheimer's. And these drugs are slowing down the cognitive decline, the progression of the disease in patients with early symptoms just like Keiko. In fact, data is showing that after about 18 months on one of these drugs, cognitive decline can slow down by up to 35%. Now, while that's not yet a cure, what it is doing is giving people more time in their jobs, more time living independent lives, more time with their memories, and more time with their loved ones. But here's the thing, the drugs also carry the risk of serious side effects. It does include things like edema or brain swelling and microscopic brain bleeds. These are things that we call ARIA, A-R-I-A. To protect Keiko, she's going to need about 4 MRIs a year to monitor her for side effects. Meanwhile, all of those extra scans, they're putting enormous strain on our global healthcare system. We already have radiologist shortages, high demands for scans, overstretched budgets, and the number of MRI scans, it's only expected to grow. So what's the solution? It's 2 letters. AI, artificial intelligence. It's helping radiologists deliver better care for more patients like Keiko. Things like making MRI scans 3 times faster, with 65% higher resolution images, and even AI-powered cameras that detect a patient's breathing to help set them up on the scanner more quickly than ever. All of which is working together to help tackle the extra demand on our healthcare services. And for the future, well, next generation drugs, they're already on the horizon. Drugs that may offer an even better prognosis for Alzheimer's patients, making MRI faster and more precise, lightening the load for radiologists, helping to put hope back on the horizon for patients with Alzheimer's, and giving more people in more places more precious time with the people they love. And now, you're in the know.
Phillips.